Prostaglandins. Prostaglandins are the product of long chain fatty acids. They are the product of long chain fatty acid. Arachidonic acid is the precursor for biosynthesis of all prostaglandins. The precursor for prostaglandin is arachidonic acid. The enzyme involved in the formation of prostaglandin from arachidonic acid is COX, that is cyclooxygenase. Cyclooxygenase is involved in the formation of prostaglandin from arachidonic acid. The main prostaglandins are prostaglandin E2, F2 alpha, and I2. Products of long chain fatty acid, precursor arachidonic acid, enzyme cyclooxygenase. Main prostaglandins are PGE2, PGF2 alpha, and PGI2. Another class of substance obtained from arachidonic acid by the action of lipooxygenase is leukotrienes. There are two forms of COX, COX-1 and COX-2. COX-1 is constitutive, that is, it is always present. COX-1 is constitutive, it is widely distributed. It participates in various physiological functions such as protection of gastric mucosa, homeostasis, and regulation of cell division. COX-1 is constitutive, it is widely present. It participates in various physiological functions such as protection of gastric mucosa, homeostasis, and regulation of cell division. Protection of gastric mucosa, regulation of cell division, and homeostasis. Protection of gastric mucosa, cell division, co-regulation, and homeostasis. Prostaglandin um, is also responsible for COX-1 is also responsible for homeostasis and regulation of cell cycle. COX-2 is induced during inflammation by cytokines and endotoxin. COX-1 is always present. COX-2 is induced during inflammation by cytokines and endotoxin. Cytokines and endotoxin induces COX-2 during inflammation. COX-2 is induced during inflammation by cytokines and endotoxins. Pharmacological actions and uses on GI tract. PGE2 and I2 reduce acid secretion and increase the secretion of mucus in the stomach. That is, they have cytoprotective action. PGE2 and I2 reduce acid secretion and increase the secretion of mucus in the stomach. It has cytoprotective action. PGI1 analog misoprostol is used in the prevention of NSAID-induced ulcer. Misoprostol is used in the prevention of NSAID-induced ulcer. Misoprostol is a PGE1 analog. PGE2 and PGI2, they decrease the secretion of acid and increase the secretion of mucus and has cytoprotective action. Cardiovascular system. PGD2, PGE2 and PGI2 causes vasodilation. PGF2 alpha constricts pulmonary veins and arteries. Thromboxane E2 is a vasoconstriction. PGD2, E2 and I2. PGD2, E2 and I2. D2, E2 and I2 are vasodilators. F2 alpha constricts pulmonary vein and arteries. And thromboxane E2 is a vasoconstriction. PGI2, D2 and E2 are vasodilators. Thromboxane is a vasoconstriction. PGF2 alpha, it constricts the pulmonary veins and arteries. PGE1 alprostadil is used to maintain the patency of ductus arteriosus before surgery. PGE1 alprostadil is used to maintain the patency of ductus arteriosus before surgery. Alprostadil, it is PGE1, It is used to maintain the patency of ductus arteriosus before surgery. Prostacyclin, that is PGI2, decreases peripheral, pulmonary, and coronary resistance. PGI2 epoprostenol is used to treat pulmonary hypertension. PGI2 epoprostenol is used to treat pulmonary hypertension. Other PGI2 analogs are useful in this condition, like treprostinil and eloprost. So PGI2 analogs are useful in treating pulmonary hypertension. Platelets. PGI2 inhibit platelet aggregation, hence it is useful during hemodialysis to prevent platelet aggregation. PGI2 is used during hemodialysis to prevent platelet aggregation. PGF2 alpha has found to decrease intraocular tension. Its analogs like latanoprost, bimatoprost, travoprost, and uniprostone are used in glaucoma. PGF2 analogs like latanoprost, bimatoprost, travoprost, and uniprost are used in glaucoma. Latanoprost, bimatoprost, travoprost, uniprostone are used in glaucoma. Uterus. PGE2 and PGF2 alpha contract pregnant uterus. Prostaglandins are mainly used in mid-term abortion, missed abortion, and in Hydatid deform mole. PGE2 in low concentration and PGF2 alpha, they contract the pregnant uterus. Prostaglandins are used in mid-trimester abortion, missed abortion, and in Hydatid deform mole. They are used in induction of labor. PGE2 and PGF2 alpha. F2 alpha can induce labor at term. Cervical priming. PGE2, PGE1, and PGF2 alpha promote ripening of the cervix, making the cervix favorable for induction and facilitation of labor. Cervical priming. PGE1, E2, and F2 alpha promote the ripening of the cervix, make the cervix favorable for induction and facilitation of labor. Postpartum hemorrhage. Prostaglandin increase tone as well as amplitude of the uterine contraction. Carboprost can be used to control PPH. Male reproductive system. PGE1 alprostadil is used in the treatment of erectile dysfunction. Therapeutic uses of prostaglandin in obstetrics, abortion, induction of labor, and PPH. Abortion. Prostaglandin stimulate uterine contraction and causes ripening of the cervix. Prostaglandin induces uterine contraction. Prostaglandin cause, they stimulate uterine contraction and ripening of the cervix. Dinoprostone vaginal is used for induction of mid-trimester abortion, missed abortion, and Hydatid deform mole. Dinoprostone is used for induction of mid-trimester abortion, missed abortion, and Hydatid deform mole. Misoprostol, oral or vaginal, is used in combination with mifepristone. Misoprostol is used in combination with mifepristone or methotrexate to induce abortion in early pregnancy. Carboprost IM is used to induce abortion in the second trimester of pregnancy. Gemoprost, that is PGE1, and Dinoprost PGF2 alpha are useful in inducing abortion. So prostaglandin, they stimulate uterine contraction and cause ripening of the cervix. Dinoprostone, it is used in mid-trimester abortion, missed abortion, and Hydatid deform mole. Misoprostol is used in combination with mifepristone to induce abortion in early pregnancy. Carboprost is used to induce abortion in the second trimester of pregnancy. Gemiprost and dinoprost. They are also useful in inducing abortion. Dinoprost, which is PGF2 alpha, mifepristone, sorry, misoprostol is used in combination with mifepristone. So dinoprostol, misoprostol, carboprost, gemiprost, and dinoprost. Gemiprost is PGE1. Gemiprost is PGE1 and dinoprost is PGF2 alpha. Gemiprost is PGE1. Prostaglandins can be used to soften the cervix for induction of labor. Prostaglandin E2 can facilitate labor by softening and dilation of the cervix. cervix को dilate और soft करता है जिसके कारण labor induce होता है. Carboprost IM and misoprostol oral can be used to control PPH. Three therapeutic uses of prostaglandin in obstetrics, abortion, to control PPH, and to induce labor. Side effect, adverse effect: nausea, vomiting, diarrhea, fever, flushing, hypotension, backache due to uterine contraction. Injections are painful due to sensitization of nerve endings. Side effect, nausea, vomiting, diarrhea, fever, flushing, hypotension, and backache due to the uterine contraction. Nausea, vomiting, fever, diarrhea, fever, flushing, hypotension, and backache. Injections are painful due to the sensitization of nerve endings.